So can you talk some more about insurance coverage? And because I'm sure that there's a lot of people who have lost significant amount of skin and they think I'd really like to do something about this, but I don't have the money to have some, big surgery.
Right. So 10, 15 years ago, the world, 10, 15 years ago was significantly less, but because of gastric bypass surgery and lap bands, there were still patients that we did body contouring on and got insurance to cover them because they were reconstructive. Patients with gastric bypass surgery or bands or sleeves, any of those surgeries, could lose 150 pounds, 200 pounds, 100 pounds, these big weight shifts. Those big weight shifts change a body. They leave a lot of loose skin. And then loose skin has consequences. People get rashing under them. It interferes with their ability to do activities of daily living. It gives them a hard time walking. They can't exercise. They can't wear normal clothes. So insurance started to recognize that, and surgeons came out and said, hey, look, this is a functional improvement for this person's quality of life. They will be able to live their life better, do more things, be more active, be more functional. So they recognized this, and the approval started to happen for weight loss surgery in the right patient, the right circumstance, where patients actually do qualify and need this. Now, that's significantly more exaggerated now because we have so many more people now taking the GLP-1s. They don't have to undergo surgery. They just go get the medicine. It's easy to do, and people are losing a lot of weight. So it's not that it wasn't approved before. We just see a lot more of it now and have more experience that since we've been doing it for the last 10, 15 years. So there is a pathway and a route to get these approvals for these patients. So it is very helpful. Patients go through this journey of transformation where they're morbidly obese. We see some patients are 300, 400 pounds and they come in, they've lost 200 pounds. They feel totally different, but they haven't they need to complete that journey for themselves to be able to go out and enjoy this new body that they created for themselves. And that's where the body contouring comes into place. So they can really experience the joy of being a smaller person. They don't have that extra stigmata left over of being really overweight from that skin. The skin prevents them from being able to do the things that they have earned at this point. And that's where these surgeries come in, is to help them get to that point and get them to the finish line.
Okay, so can you talk to the concept of doing this so frequently versus somebody who does it occasionally? What has developed in your expertise over the last couple of years?
So I think we're talking about surgical experience and the frequency that a surgeon does a particular procedure. And I will tell you, I think this makes a difference across all realms of surgery, whether it's someone who's doing a Whipple, which is where they take out pancreatic cancer and do all these surgeries, something really complex, liver transplant surgery, all the way to an appendectomy, a facelift, body contouring procedures where we do paniculectomies or all the other surgeries, removing extra skin on the arms, thighs, breast reductions. People that do this kind of surgery regularly or any kind of surgery regularly, obviously that level of expertise and experience goes a long way. There's a familiarity with the tissue, the structures underneath. Complications should be less, recovery should be faster, because for someone that's doing a lot of these surgeries, like we'll do 3 or 4 a week, sometimes we'll do 5 or 6 in a week. Very different than the person that does it once a month, once every couple months. We're in there all the time in that exact same area, so the familiarity with the tissue is a lot better. I think we'll be a lot faster just because we know how to get in and get out. We'll do paniculectomies in under 3 hours, doing muscle tightening and moving the nipple, moving the belly button all in one session, and we'll be done less than 3 hours on a surgery. Where sometimes that surgery can take 4 or 5 hours for people that don't do it regularly. So we become a lot more efficient, and I think that's reflected in our outcomes, and patients do better, they heal better, they recover better. And not just for me in body contouring, but for any field of surgery, I believe that to be true.